Public Protector Advocate Busisiwe Mkhwebane is this afternoon releasing investigation reports. We go back to that virtual briefing.
2017, the Clinical Associate Training and Profession, Current Successes and Future Steps, which we will call the Testing Report. The report was intended to aid the department in formalizing the way forward for clinical associate with the approval of the National Health Council. The report addressed several key issues relating to the clinical associate profession and outlined recommendations for these challenges being experienced by clinical associates. Since the finalization of the report, however, the department has delayed or failed to adopt the implementation of the recommendations therein. Thus, the challenges experienced by the clinical associate relating to integration within the health system, conditions of service and their development continue to persist. It was Mr. Ngobo's contention that the complainants were, in the circumstances, aggrieved by the conduct of the department as set out above and requested the intervention in the matter. Having studied the complaint thoroughly, we decided to focus the investigation on whether the department has unduly delayed to address the challenges experienced by the clinical associates and to process the tasking report for consideration and possible approval. We found that the allegation that the department has delayed to address the challenges and to process the report was substantiated. There was undue delay on the part of the department in taking the report through for consideration and possible adoption following its completion in 2017, including relevant governance structures such as the internal audit and audit committees. It has been considered that the subpoena deliberations, during the subpoena deliberations on the 9th of June 2021, that the report never served before the Executive Committee or before the National Council, Health Council. Hence, the undertaking from the department that the report will now be taken through the appropriate channels for proper consideration. It is further noted that the undertaking comes approximately 4 years after the finalization of the task team report and only after the intervention from the Public Protector's Office. The department considered that through its submission to the Public Protector that there was a lack of formal communication with the complainants, particularly regarding the challenges which gave rise to the non-implementation of some of the recommendations of the task team report. In this regard, it was noted that the concession was further accompanied by the undertaking that going forward, the department will make the effort to communicate with the complainants regarding this matter, particularly to ensure that they formally engage with complainants by 16 July 2021. So that's one of the interventions. And in terms of Section 195(1)(a) of the Constitution, a high standard of professional ethics must be promoted and maintained, and development orientation should have been promoted and adhered to in sculpting a way forward for the profession since the time of its inception. Where challenges presented themselves in the adoption and implementation of the recommendations contained in the task team report, the department was required to act with transparency as required by Section 195(1)(g) of the Constitution, by making known to the complainant who are most affected by the issues of non-implementation of the report, and for the purpose of displaying accountability and ensuring that the needs of the complainants are responded to in line with the recommendations as set out in that testing report. The department acted timeously and appropriately upon receipt of the testing report and ensured that it went through the appropriate channels for consideration and possible adoption. The department would have displayed good human resource management and career development practices to ensure that human potential is maximized and cultivated as required in terms of Section 195(1)(h) of the Constitution in ensuring that the report is properly dealt with. In terms of Section 3, subsection 1C of the National Health Act, the Minister of Health must, within the limits of available resources, determine the policies and measures necessary to protect, promote, improve, and maintain the health and well-being of the population. So the National Department has, since its inception of the clinical associate profession into South African health system, being enjoined to provide policy determination and strategic way forward for clinical associates, in as far as they were introduced for the purposes of the betterment of the health system. However, observing from the issue giving rise to this complaint, there has not been a proper way forward to facilitate adequate integration and development of clinical associate profession. That is, through taking the tasking report through the Executive Committee and the National Health Council for way forward to be established for clinical associates. Furthermore, there was evident neglect by the department to take their report through appropriate governance structures. And the conduct of the department accordingly constitute improper conduct as envisaged in the Constitution and maladministration in terms of the Public Protector Act. To remedy this improper conduct and maladministration, the Minister must ensure the following: as undertaken by the department, that there would be formal engagement with the complainants pertaining to this matter. The department is to, within 30 working days of this report, furnish the Public Protector with the records pertaining to the engagement, and they, where applicable, furnish the Public Protector with the record of any other subsequent engagement relating to the matter therein. Regarding the undertaking made by the department to re-engage the Department of Public Service and Administration to motivate for a holistic review of the occupational specific dispensation as a remuneration framework in the public health sector, that is inclusive of clinical associates and sustainable, the department is to, within 60 working days of the date of this report, furnish the Public Protector with feedback regarding the outcome of that engagement. Should the salary structure be included in the OSD, then the department should also ensure that corresponding costs related to the compensation of employees should be met within budgetary allocations or the vote in order to avoid unauthorized expenditure as required in terms of the Treasury Regulation 8.3, read with the PFMA Section 76(4)B and Treasury Regulation 9, read with the PFMA Section 38(1)G and 76(2)E. Regarding the undertaking made by the department to convene a meeting for purposes of synthesizing the task team report with the executive authority and provincial departments, together with the undertaking to report back on this engagement, the department is to, within 60 working days to date of this report, furnish the Public Protector with feedback accordingly. And regarding the undertaking made by the department to conduct a review of the program performance, thus far to assess various aspects of the program, including uptake since its establishment, the impact on health services, career pathing or advancement prospects of clinical associates, status of mid-level policy interventions generally, and other parameters that may be of relevance to guide decisions on the program. The department is to, within 30 working days of the date of this report, provide us with feedback on the review proposal tabled with the National Health Council on the 18th of November 2021. In line with the proposal made by the department for the process to be followed for review, the department is, within 30 working days of this report, and thereafter every 60 days, provide the Public Protector with monthly reports on the procedure set out for the review of this whole process of clinical associates. The following approach to the review was proposed by the department, which they will finalize and sign off terms of reference for the review in consultation with the relevant stakeholders to be completed by the 31st of March 2022. Avail funding for the review process during this financial year, which is 2022-2023. Source the service provider to perform a review using both quantitative and qualitative methodology immediately after the signing of the terms of reference by January 2022. Conduct and finalize the review by 30 November 2022. NAC to sign off the recommendation and publish them by March 2023. For the department to source funding to implement the resolution of the NAC during the MTEF in October 2022 for the 2023-2024 financial year, and the department to implement the resolution of the NSHSC during the year financial 2023-2024. So regarding the undertaking to engage with the Health Professions Council of South Africa to request that the matter of prescribing rights be finalized without further delay, the department is to, within 30 days of issue of the final report, provide monthly progress reports regarding this matter until its conclusion. We are pleased with the Minister of Health's exemplary cooperation during the investigation, especially the current minister, and his commitment to implement the remedial action. We look forward to the implementation of the remedial action so that we can take the complainant as close as possible to where they would have been had it not been for the improper conduct and maladministration. We are available to assist with the implementation. Thank you, ladies and gentlemen, for your indulgence. Copies of these reports will be shared with the affected parties shortly. The public will also be able to access the copies through our website. We will take questions, if any, clarity, if any, on these reports.
Thank you, Public Protector. The feedback we are getting from the colleagues joining us online is that it's a break in transmission. When you were dealing with the second report, and the request is that if you could please go over that part of the statement again, specifically from the second last two paragraphs on page 7, where you're dealing with the findings in relation to that matter of Gade versus Mkhwebane.
Okay, so page 7.
The last two paragraphs
Yes.
until
the end.
Until the end of that specifically.
Okay. The matter of Gade, the complaint which was lodged by Gade versus Mkhwebane is report 36 of 2021-2022. We focused the investigation on whether the former Premier, Mr. Mkhwebane, violated the Executive Ethics Code in respect of his alleged facilitation of the delivery of Bonsmara cattle to the former President's homestead, and if so, whether such conduct amounts to improper conduct. We found that the allegation that the former Premier violated the Executive Ethics Code through his involvement in the facilitation of the delivery of the Bonsmara cattle to the former President is not substantiated. From the evidence sourced independently and also provided to the Public Protector, it is apparent that the former President did receive the cattle from AgriDelight as confirmed by the payment made for the cattle by AgriDelight. The delivery of the cattle and the submission of AgriDelight Managing Director, Mr. Muntswe. Although Mr. Muntswe contends that he personally donated the cattle to the former President, his use of the AgriDelight's FNB account and not his personal account to pay for the transaction does not support his version. However, the matter pertaining to AgriDelight's flow of funds under Mr. Muntswe's management is receiving the attention of the law enforcement agencies. To this end, the Directorate of Priority Crime Investigation and the Asset Forfeiture Unit assist with the matter. It is also clear from the evidence relating to the payment made for the delivery of the cattle that the department itself did not fund the payments for the said donation and delivery of cattle to the former President. Therefore, no state funds were utilized for the payment and delivery of cattle to the former President, which would have directed the Public Protector to investigate and pronounce on that in line with her mandate and jurisdiction. There is also no evidence to indicate that the former Premier abused public trust and the fiscus for his private benefit, thereby violating Clause 2.1 and 2.3 of the Executive Ethics Code. In line of the aforegoing, we have therefore decided not to pursue the matter any further and thus finalize it by means of a closing report.
Thank you, Public Protector. We check in the room if the colleagues have got any questions. We have not received any questions also through the WhatsApp line. It appears that everything is clear. And in the absence of questions, let me find out from the Deputy Public Protector if she would like to contribute any remarks to what has transpired here today. Then we can bring the proceedings to an end. Deputy.
Thank you, Mr. Tshale. I think the emphasis really is to really call upon other state institutions to really take the example that has been done by the Minister of Health. Firstly, upon his appointment, ensuring that he speedily responds to the preliminary report provided by the Public Protector, but internalize the matter, which has been long outstanding with the Department of Health, and ensure that the matter at least is amicably resolved by meeting us in respect of the remedial actions that we had proposed to him. And by the time of releasing this report, actually providing us with the implementation plan which has been read out by the Public Protector. In so doing, really, it does help to uphold the Constitution, to support the mandate of the Public Protector as provided for by the Constitution, but also ensure good governance within his own department, which is really an issue that other state institutions are indeed grappling with. So we really call upon specifically executive authorities to really take up the opportunity provided by the Public Protector South Africa to ensure that we participate towards ensuring good governance and eradicate all malfeasance and maladministration within state institutions. I thank you.
Thank you, PP. Thank you, PP. In the absence of any questions from both colleagues in the House and those joining us remotely, I propose that we adjourn the press conference. We will be sharing the statement on all the platforms, and that will be followed by the report on the website. Thank you so much.
Thank you.